whole therapy.
Yeah.
Okay, consider this, we will make a whole therapy. Doctors go to setting. Okay, in the setting, you see we have options. Gas therapy, MPT, irrigation gas, MPWT gas, MPWT and only MPWT. If they want to make whole therapy, they have to choose this one. MPWT, irrigation gas, all of them. Okay? And then it's always better to choose patient. So you see, patient name, doctor name, event, age and gender.
For the record.
For the record.
So we can type there?
Yes. So they can see what they did and how many, times, how many days it gets healed.
Yeah.
It's asking you irrigation settings. Of course, these are all according to the doctor choice. Okay? He can change. Wait after irrigation 5 minutes, 6 minutes. Wait after irrigation means we give the water here, okay? And how many minutes later I want to make suction again. Cycle. I can say, okay, the distilled water or ozonized water or oxygenized water has to stay there 10 minutes, 20 minutes. Then I will suck it. It depends on the wound and the doctor, definitely, okay? Because sometimes in debridement, the narcosis cells stay on the wound, they are dead cells, and they physically try to get them. But with this, you can make also. If the water stay there 10 minutes, then it can remove. It makes it softer, and you can remove it and get it. Then we have option moistening every hour. So it depends on the doctor choice again. He can on or off every hour moistening. He can say no, I don't need moistening every hour. It will give and take back every hour. And it's asking you irrigation type. You can choose distilled water. You can choose ozonized water. You can choose oxygenized water. So according to the choice of the doctor, for example, if you choose oxygenized, then it starts to give oxygen into the water. Okay, after the 5th hour, then it will start, oxygenized.
When you say oxygen water, the machine will put the oxygen in the water.
Yes. There is a famous creams that ozonized olive oil creams. You can make with this device also. You can put the cream and you can ozonize the cream. We have ozone generator in it. Actually, this is a technology. We get oxygen from the device supplier and we change oxygen to the ozone. And after we choose, we go next. Now it's ask you, because after irrigation, we will give gas. Do you want gas type oxygen, ozone and oxygen? Because we don't give directly ozone. We give concentrated and mixed ozone and oxygen. Ozone has a burn effect, so we have to mix it. I can also send you the percentage of the ozone and oxygen in the device giving. Okay, we choose oxygen, let's say. Now it asks you regular vacuum settings. Now it's asking you MPVT settings. Duration of the therapy minimum 12 hours.
So that means 12 hours can use this continuously.
Yes. If we choose like 168 hours, which means 168 saat bir hafta mıydı? 1 week at most. Okay. 1 week, if he goes, of course he has to come back in 3 days later. It can continue to do the same therapy. It's asking you small wound size, small, medium or large wound. Start with set vacuum. We have different set vacuum mode.
When you say small, medium, large, this is relating to this
size of the, yes.
Okay.
Yes. It says start with set vacuum. Start with set vacuum means you can start, for example, you want 120 vacuum. Okay, and you want it continues to like this. Then it starts with this and goes like this. Feature. So this is important. Start with incremental vacuum means it will go, okay, stay, for example, in 40 and then exit again. This is why you can use this machine for the child and for the old people. So you give very low and you see if they feel the pain. Okay, so slowly you get the vacuum exit. And we have 2 choices. Okay, start with set vacuum and start with incremental. Then you say continuous vacuum, intermittent vacuum, which means, for example, if you want to make 120 till the end of the therapy, you have to choose continuous vacuum. This is very common. And if you want to choose intermittent vacuum, which means, for example, you come up, okay, and then you want it like 10 minutes has to be lower. It goes 10 minutes, reduce, and goes up again like this. Okay, it's also for the pain again. Then you know next.
That one will depend on the patient. If
Yes.
the patient feel pain,
Definitely. Again, about the doctor.
right.
And the range is written there, I think, in our user manual. Then it's asked you, do you want TENS? Electro TENS, on or off? We choose on. Then it's asked you, TENS level, low, medium, or high. This is also about the doctor. Doctors ask us, okay, what should we do? You know, this is very low electricity, so they just feel like little ant are walking there. They can ask the patient, do you feel this? If they say yes, I'm feeling, then it can give this electricity.
Okay.
Like physical therapist, physiotherapist use
Physiotherapist,
this,
yeah.
yes. And we choose working duration, 5 minutes to, I think,
But all can work at the same time.
yes,
Oh.
30 minutes. Okay?
No, I mean, you can still do this one and then still do this one.
Yes,
Everything.
yes,
okay.
in one 12-hour period.
Oh.
And when you say start, therapy
Then
starting.
start. And you have the list of the setting here.
Yes.
Yeah.
And one more thing, we have dressing test status in all of our devices. Why we put it? You know, sometimes doctors take dressing and they say, oh, my dressing is very well, but your device has leakage.
Okay.
Then how do you know your dressing is very well? Please send me a video.
Yeah.
Okay, they send us a video and I can see that there are some leakages. Okay, it's not. Sometimes
Not
they
full cover.
open this one.
Yeah.
Yes, full cover. It depends on the place. For example, there are some soft places, not the all like this. You know, everywhere can be wound. Everywhere you can think, you know. So
even at the buntut, but
yes,
because it's curvy, you know.
everywhere, sir.
Okay.
Like sexual organs,
Yeah.
you know, we see like the middle of the S, I can say
Yeah,
you,
yeah.
everywhere. So it depends. Breasts, they are soft, you know, different places, liquid places. So you cannot say, no, I do my best and there is no leakage. Yes, there is a leakage. So this, we make test for the dressing, okay? Then it shows you how is your dressing before starting the therapy.
Bu iyi bir lansman değil. Kaçağı var.
By the way, this dressing has a leakage because we are playing on this. You know, but see, it shows you your vacuum is good.
Okay.
Not excellent, but good. It's
Yeah.
still good. See, after it waits some minutes, it's getting down again. Okay, test finish. So that I can continue. Then we start the whole process starting. Okay, this is how we do all therapy together. As I told you, if you don't want to make electrotense, you can move and you can set electrotense off. But we can tell you if there is infection, a lab infection, then they have to use ozone and oxygen because it kills the bacteria, you know, with
Okay.
ozone and oxygen.
Yeah.
So it's good. If the wound is so dry, then they can use irrigation. Some burns, for example, they have to make irrigation also at the same time. And all of our devices have moistening every hour, which means when you open it, every hour it gives a little moistening into the wound, so it will not stay dry. I mean, some of them says, okay, after 2 days, I stop making vacuuming and I use other creams, you know, something.
Yeah.
No, please. No, they have to use it non-stoply, like maybe weeks, maybe 2 weeks. It depends on the wound. Till it heals, they have to use it non-stop.
Understand. So
You understand?
we will suggest them no need to use any gel or any
Yes.
medication.
I mean, we have with this device, especially with this device, everything to heal the, you know, wound.
Yeah.
Yeah.
But our boss is always telling this. We are not healing the wound, you know. We make the body to heal itself faster because it has, you know, wounds has some liquid,
Yep.
you know,
Yeah.
blood cell liquid.
Right.
For example, if burn here,
Yeah.
then it becomes like a
Yeah.
mountain,
Yeah.
and body makes its own self, own drug. So we make it just to remove the bad cells and the dead cells, then make the body again to make alive cells. Okay, or just we are supporting actually. If wound is not so good, we say okay, 10 therapy averagely. 10 WAC. 10 WAC means like 30 days. Yeah, at most every 3 days they have to change the sets. Sometimes they say, okay, my canister is not full in 3 days like this, and my exudate is not a lot. My boss tell me, just tell them to change it every 3 days.